And there's going to be a lot of information, and I've tried to keep it simple so we can all follow and hopefully be able to do some of the strategies that I talk about. But what I wanted to kind of concentrate on is kind of explaining a little bit about what causes the weight gain. Because, most of us are thinking, oh, it's only calories. Well, there's a little bit more. So let's get started. All right. So weight loss involves several different things. It's not just dieting. It is not just exercising. It is not just being on the right medication supplements, okay? It has to do with all of the above. It's metabolic, hormonal, especially women post-menopause. All of a sudden, you're looking like, what is going on? I haven't changed anything. And you kind of have to make lifestyle changes. Because if you just do a bad diet, yeah, you may lose weight, but if you don't make those changes, you are going to gain it back. And those pounds are going to come with friends. And then you're going to feel worse. Okay? So, GLPs, that's what we hear about. That's what everyone talks about. This is how they lost weight. Well, the thing is, not everyone can tolerate these medications, okay? They do come with their side effects. The other thing is, just like I said, we want to make lifestyle changes that we can maintain. So not just not eating enough or suppressing the appetite, we need to work a little bit. These are tools and they have their purpose. But if you incorporate these lifestyle changes, changing what you eat, what you want to do, activity, you can sustain it and you will see great results. And like April said, and I've also done it, I lost close to 50 pounds. It didn't happen overnight. It did take over a year, but I've been able to keep it off. So, all right. Other reasons that people may want to not do these GLPs. Not only they're not tolerating, you could get nausea, constipation. That makes anyone miserable. Okay? Someone that wants to lose weight because they want to start a family. They don't want to start a medication when you're trying to, optimize your body to house a little baby there. History of eating disorders, bulimia, anorexia. You want to make sure that you make changes that won't get you to slip back into those conditions, okay? And that if you want to have long-lasting results, again, we need to not just do a medication, okay? Everyone found? All right. So calories do matter, okay? It's not like you can optimize your body, but just eat what you want. They do matter. However, they're not the only things that matter, okay? Believe it or not, chronic dieting can slow down your metabolism. Your metabolism, when it's slowed down, you can eat two lettuces a week, and you'll still gain weight, okay? Sometimes it almost feels like you could snip a piece of cake and you've gained 2 pounds, okay? So when the body doesn't know how many calories it's going to consistently get, it'll slow down the metabolism, okay? Same thing goes when you're on a diet and you restrict your calories too much. Your body is going to say, oh, I don't know when I'm going to get any more food. I am going to hold on to every little calorie that I can because that's our energy, okay? Stress and sleep. We live in a world where stress is just part of our lives. Most of us probably can't get 8 hours of sleep a night. That will affect your weight loss or lack thereof. Now, I'm going to talk about these and I'm going to explain it a little bit in the next few slides, okay? Insulin resistance and blood sugar imbalance. That is one of the leading causes of weight gain. Okay. Chronic stress. Chronic stress makes our body produce more cortisol, which can prevent weight loss. That or you will find that you will gain weight right in the middle. Okay, that is good old cortisol. Poor sleep quality, sleep apnea. Those who have sleep apnea are getting proper sleep because they're waking up. Even though you may not be conscious, your body's waking up, so you're not getting rest. Loss of muscle mass with age. Muscle is very important in weight loss. The muscle will help burn energy or calories. It's where we get our energy from. If you have muscle, even if you're not actively exercising, you will still be burning calories, right? But that muscle is very important. Also, hormonal shifts. Again, ladies, when we're hitting that perimenopause, menopause, our hormones though all wonky. That will definitely cause an issue with our weight loss efforts. Insulin resistance. So insulin is a fat storage hormone, okay? It traps fat inside the cells, the resistance, and it will lead to cravings and fatigue. So when your blood sugar levels are not doing good, when your body is producing insulin but not using it properly, this insulin resistance will prevent you from being successful in weight loss. So another thing we talked about, high cortisol, stress increases your cortisol, which encourages fat storage, right? For sleep, you get hungry, you crave things. I know sometimes when I don't get enough sleep, even just to try and stay awake, you're kind of grabbing at things. And stress management, as it says, is not optional. Stress will not only affect our weight loss, it will affect our mental health and our physical health, believe it or not. When, I don't know if y'all are heard, stress can kill, eventually it really will. All right. The thyroid and weight loss. The thyroid is a very important organ, okay? It is responsible for our metabolism. It's also responsible for our hair, our skin, our nails, temperature regulation. When our thyroid is suboptimal, T3, that is actually the active thyroid hormone that our body has. Low T3 will lead to fatigue. If at 2-3 o'clock, you're, oh, I really wish I could go to bed, that's probably you have low T3. The thing is that normal labs, normal TSH, what primary care will screen, will not show if you have low T3. TSH is the hormone the brain makes to tell the thyroid, hey, I need you to make hormone or you're making too much. So that T3 is important. So a little bit about GLP versus non-GLP. So the GLPs, yes, they suppress your appetite, but you do have to continue to use them because once you stop using them, if you don't change the way you eat or your relationship with food, you're going to gain it all back. So they do require ongoing use. And lifestyle changes, and I'm still talking about sleep and stress in this too, they will improve your insulin sensitivity. So your body will be able to use the insulin appropriately, and then you'll be able to lose the weight and maintain it. So now, this is one a lot of us struggle with. What are realistic expectations? I don't know about you, but when I first started this, I wanted to lose 10 pounds the first 3 days. That's not healthy. Healthy fat loss is 0.5 pound to 1 pound a week. That's healthy and sustainable weight loss. Things that we also have to think about are, let's not focus solely on the scale, because that's not going to tell us how our bodies are really functioning. So early wins, things you may start to notice. Oh, I have a little bit more energy. Oh, I don't feel like I need to go back to sleep after I just woke up half an hour ago. And then your clothes will start to fit better. You're just gonna feel overall better. Now, movement, that is another thing that we need to do. Daily movement will boost your metabolism. And I'm not talking about running 3 miles, hitting the gym for 3 hours. We need to starting slow will again help you maintain, and you're going to continue your new lifestyle. Walking after meals, walking around the block. That's how you start. You don't have to start with 3 miles. Start with going from your house to the mailbox. And then you continue increasing the length of your walk. Now, with the muscle resistance training, this is where KB Fitness will come in. Building those muscles will definitely help burn fat and also get more energy. All right. The muscles, important thing, many of us want to lose weight without incorporating the exercise. The muscle is important because it will burn the energy, the fat, give you energy all day, whether you're moving, whether you're sleeping, brushing your teeth, watching TV. So you need to put that effort in order to get some muscle. And I'm not talking Arnold Schwarzenegger muscle. You just need to have some lean muscle. All right. So now this is what we all came here. What can we do? So we need to eat real whole foods. I'm talking about the fruits, the vegetable, team meat, okay? You've ever noticed the supermarket, all the fruits, vegetables, all the meats and the dairy are out in the perimeter. When you go into the aisles, that's where it's the canned foods, the ultra processed. So first shop that perimeter. That's going to be your best bet, your healthier foods. Okay, is a big thing. We need protein to give our body some energy. So that's what we need to concentrate on. Just having a salad is probably not going to be enough because you need to add some of that protein in there. Now they have some very good protein replacement shakes that you can supplement, but nothing beats a nice organic chicken breast or some organic foods. Colorful. I remember when I was in school, they used to say, eat the rainbow. And they're true. It holds true. Leafy green vegetables. You have your red and yellow peppers. You have your orange carrots. These are all, the more colorful, the better it's going to be for you. Right? Reducing that ultra processed carbs and sugar. If that's that middle aisle right there. And that will then help to stabilize your sugar, reduce those cravings. That's what we want. It may be difficult initially, but your body will get used to it. And then after a while, when you eat something like sweet, your body's gonna be like, no, I'm good. You're not gonna need it, okay? Seed oils, artificial sweeteners, not everything that is diet is good for you. These artificial sweeteners are also not so great for your weight loss efforts. Limit alcohol. Alcohol is one of those things that it can prevent you from losing weight. That's liquid calories. You can drink and not feel full, so then you just had 300 calorie glass of wine, and then I'm gonna go eat. And then when you're feeling a little good, and we're not gonna think, oh no, I have to eat healthy foods. We need to say adios to the alcohol if we want to be successful and healthier. All right. Other additional things that we can do. Optimize your hormones. Let your hormones check. If you've tried every diet, not been able to lose weight, feeling kind of crappy, have no motivation to go exercise, maybe it's a hormonal issue. Okay, muscle, walk, those little walks, they count. They don't let someone tell you that, oh, you walk, it's not enough. Every movement counts. Okay, sleep, try and get those 7-8 hours of sleep. I know it's difficult because we so much stimulation, but that is very important. And stress reduction. Learn some coping skills. Try and reduce some of that stress that's not needed in your life. And then there are also some vitamins, supplements, and peptides. Now, peptides are another up-and-coming thing that we hear about. So peptides are really these little amino acid chains. Our body produces them. And when we get specific peptides, it'll kind of our body what to do. It kind of our body to produce certain hormones that are essential for weight loss. There are peptides that are available. So if a peptide, it's not a hormone, it's not a medication, again, it's just amino acids, set up a free consultation. We'll be gladly tell you all the available peptides for weight loss, for reducing some of that adipose tissue in the tummy, giving us a little bit more energy. Just the options are endless, really. Now, with vitamins, some of the vitamins are very important for our metabolism. And some of the vitamins that we offer are used in our weight loss program. A super fat burner. It has high doses of B12. It has MIC, taurine, arginine, carnitine. These are all important for cellular function, boosts your metabolism, gives you some energy. I've had a couple of patients that what they did was change their lifestyle and just use a vitamin shot once a week. And that's kind of what helped them get that energy. So another one, which is one of my favorites, is the keto shot. So the keto, same things, B12, taurine, arginine, and carnitine. It has MIC, but it also has glutathione. Glutathione is a wonderful anti-inflammatory excuse me, I'm sorry. So glutathione will help with inflammation. So if you're having those little aches and pains, this will help with that. Which, hey, if I'm not having those little aches and pains, I may want to go for that little walk. So it also helps detox the liver. So again, we need to just optimize our whole body. Now, like Ms. April said, weight loss without GLPs is possible. People have been doing it way before GLPs came around. But we need to make some changes. When people gain weight or are unable to lose weight, it's not that you're broken. We're just responding to our environment. And in this chaotic environment that we're in, stress is high, poor sleep. Sometimes we're working so much we can't get to the supermarket, so we just, whatever's open, whatever we can grab. So we need to kind of our lives and determine what are we willing to do. Are we willing to make sustainable changes, or are we just going to continue to slowly eat away and the stress, and essentially we'll die? We don't do this. Personalized support, that makes a difference. If you have someone that can hold you accountable, give you some tips, maybe also have a buddy to do it with. You can guide each other. That is very important. Sometimes we just want to be like, oh my gosh, I wish I could talk to someone because I could eat a whole cake right now. Well, maybe if you have someone to talk to, go on a little walk, a little trip, then we won't be wanting to that. So that's very important. So all here for you. Some of us don't have family around. So you know what? Come to us. Well, we'd always try and take our time, and we can give you those little tips and encourage you. And we're going to have good days, and we're going to have not so good days. Well, you know what? Sometimes you just need that someone to help you through the not so good days. And it's not all about the scale. You help us kind of focus on just the scale. And that's more way. There's more to it than that. Okay? Do we have any questions, concerns? Anything good?
Intermittent fasting. What's something good to do?
Yes. Intermittent fasting can be very good to do if you do it the correct way. So not everyone will know exactly what to do, what to drink. There are ways to do intermittent fasting. That's kind of sets your body. Okay. When you're eating only in a certain hour or a certain hours, you have a little bit more control. But it can set some people up for failure if you don't do it correctly. And we do incorporate that in our weight loss programs if people are interested.